DSM-5 criteria, diagnostic and statistical maneuver 5, 5th edition criteria for diagnosing a major depressive disorders. It's common major depressive disorders we fail to identify. In fact, in children also, 3 to 17 years old, its incidence is around 3%. So lifetime prevalence may be higher, around how much, 5 to 13% or so. Genetics is involved in good amount of time. At times, due to neglect, abuse, chronic disease, isolation, disharmonious environment, and violent prone place are the risk factors for this sort of the depressive illnesses. These children, they are depressed, they are sad most of the time. Good amount of time they feel unhappy, tearful at times. They have diminished interest and pleasure in people and they walk around. They have insomnia. They at times reverse. They have hypersomnia and they have psychomotor agitation and retardation. The feeling worthless at times, inappropriately guilt feeling is quite common, and diminished ability to think and concentrate. So their thought process are involved in the death and suicidal ideation at times, which is very much what sort of things, and they lose energy, they feel fatigue, and good amount of time, and 5% weight loss is also possible because they are not careful about their diet. So this ultimately whole thing causes social impairment. These children do not grow well, they do not read, they do not accommodate their job description. So there is social impairment, school impairment, and there are other sort of impairment if it is in the chronic process. So how to deal with these things? 50 to 60% of this the depressive illness, they recover spontaneously, and but not with non-specific intervention, another 20% or so, that should be given insight, and so milder symptoms they resolve, but severe sort of things, the symptoms takes time to resolve. So they can be guided, and the your by what, the social and physical engagement, they should be involved in their own work, study, the family, and other sort of involvements. Help them to keep busy with their work schedule. In fact, every human body, human being, should have something to do. Otherwise, you will feel bad. You will feel depressed. So meditation and yoga therapy at times is useful, and the social involvement, the work involvement, good and a high quality work involvement can give to the better quality of life, can avoid depression. So if we no response with the self-guided therapy, there can be cognitive behavioral therapy by an expert psychotherapist. Problem solving approach should be there from psychotherapists. They know what to do. In worst possible case, you need the selective serotonin reuptake inhibitors like fluoxetine and the PRAMs, escitalopram and other PRAMs. Try 1 to 2 months. If they do well, then continue this medication for 6 to 12 months.